Um, Kia ora koutou. Good afternoon from Lower Hutt, or good morning to some of our international guests. My name's Sarah Bell, and I'm a project lead and senior researcher here at the Helen Clark Foundation. Welcome to today's webinar entitled From Risk to Resilience, Protecting Health in a Changing Climate. A particular welcome to new members of the Foundation or to guests who are joining one of our webinars for the first time. If you're not yet a member of the Foundation and you're keen to support the Foundation's mission of developing solutions to New Zealand's long-term challenges, we're currently offering a free tote bag for all new New Zealand-based members. Victoria will put a link in the chat if you'd like to sign up for the Foundation or learn more about our work. And we've got a really exciting research agenda coming up this year with projects on infrastructure, the creative sector, social cohesion, and agri-technology all underway. And we look forward to updating you on these in the coming weeks. And next up in our calendar is a webinar on Monday the 16th on harm reduction in New Zealand drug policy. We'd love it if you could join us for that, and you can do so on our website. So on to today's webinar. First up, our standard reminder, this is a webinar, not a normal Zoom call. So if you're not on the panel, your cameras and microphones are off and you're safe to eat your lunch without being seen or heard. We would love for you to participate in the webinar though. So the best way to do that is to submit questions for our panelists in the Q&A function on Zoom, which you can find at the bottom of your screen. And later in the webinar, Lucy, our moderator today, will put as many of these questions as she can to our panel. You'll see there's also a chat function at the bottom of your screen, and Victoria will be posting links in there during the webinar, and you're welcome to talk to each other there. But if you've got questions for the panel, please do post those in the Q&A area. So today's webinar is brought to you as part of our Foundation's Honorary Fellows Program, which sees respected policy thinkers producing op-eds and convening webinars like today's in their areas of expertise. We've got a fantastic example today of the value that program brings to our audience and to the public conversation about key policy challenges in New Zealand. So our Honorary Senior Fellow Lucy Castles is a global health and environment policy commentator and researcher. She's a former career diplomat and senior public servant who's held a range of roles at the New Zealand Ministry of Foreign Affairs and Trade and the Ministry of Health. She's worked across UN bases in Geneva and Nairobi, focusing on global health, environment, labour and migration. And during the COVID-19 pandemic, she spearheaded a range of health diplomacy processes for the New Zealand government at the WHO in Geneva. More recently, she served as Deputy Secretary at the Ministry for Pacific Peoples, and she's currently an Honorary Senior Fellow and Researcher at the University of Melbourne School of Population and Global Health. Lucy is bringing together the expertise and relationships that she's developed in the global health field to present today's webinar with two leading experts from our region, Professor Sir Colin Tukuitonga and Dr. Sandra Di Maio. We're thrilled to have all three of them here today, and I'll hand over to Lucy now to get started. All yours, Lucy.
Thanks, Sarah. Tēnā koutou katoa, everyone. And in recognition of those we have joining us from the Pacific region today too, whakaolofo lahi atu, kia orana, talofa lava, malo e leli, inisa bula vinaka. Warm greetings to all of our listeners from Aotearoa, the Cook Islands, Niue, wider Pacific region, global health family from Seoul, from Melbourne, Kuala Lumpur, Geneva, and right around the world with us today. Ko Lucy Castles toko ingoa. My name's Lucy Castles, as Sarah said, and I'm an honorary fellow here with the Helen Clark Foundation. I'm really delighted to bring two global health powerhouses to you today to share their knowledge, wisdom, and insights on the way climate change is impacting our region. To set us off in good grace, I'd like to open with a quick karakia or short prayer in te reo Māori. Whakatata te hau ki te uru, whakatata te hau ki te tonga, kia mākina kina ki uta, kia mātaratara ki tai, e hi aki ana te atakura, he hio, he tuka, he hauhunga. Haumie, huie, taiki. So thank you. Without further ado, we'll crack on. Here with us today on our panel, we're thrilled to have Professor Sir Colin Tukuitonga of Te Pōtoko Oroakiwa, Centre for Pacific and Global Health at the University of Auckland's Faculty of Medical and Health Sciences. And we also have Dr. Sandra Di Maio, who's Director of the WHO Asia Pacific Centre for Environment and Health, or WHO ACE, which serves the, wait for it, 38 members and 2.2 billion plus people of the World Health Organization's Western Pacific region, with advice and leadership on critical global health issues. So Colin's one of Aotearoa and Pacific's region's most respected public health leaders. He's probably well known to you, and he's well known for his lifelong commitment to improving the health and resilience of Pacific communities. He's held senior leadership roles across New Zealand, the Pacific globally, including as Director General of the Pacific Community, CE of our then Ministry of Pacific Island Affairs, and now the Ministry for Pacific Peoples, and National Director of Public Health. He's a non-communicable diseases NCDs expert and recently appointed as chair of the WHO Strategic and Technical Advisory Group on Prevention and Control of NCDs. And he remains one of our most expert and powerful advocates for Pacific health. So welcome, Colin. Dr. Sandro Di Maio is another great trailblazer. He's one of our region's most influential voices on climate and health and building healthy, resilient populations. He's a medical doctor, public health epidemiologist by training, and previously, before taking up his role as head of WHO ACE, he served as CE of Vic Health, the health promotion agency for the state of Victoria in Australia. And he's also served as CE at EAT, which was a global non-profit dedicated to transforming food systems for the health of people and the planet. Sandro remains a vocal advocate for concrete action on our regional health challenges, and you'll see him working tirelessly across forums in the Asia Pacific and global level promoting these issues. So huge welcome to you too, Sandro. It's wonderful to have you here, despite the difference in time zones that you're experiencing. Turning to the substance of the webinar, climate change it's a well-recognised threat. It's one of the most urgent threats to our health and well-being. What I see through my work and research is that our neighbours in the Pacific region have been on the climate frontline for a long time, much longer than us, and doing some courageous things to protect health and health systems. But we're not immune to that here in New Zealand either. And I think many of our listeners today will be interested to understand the health impacts for those of us here at home in Aotearoa, New Zealand. So we're going to ask you too, Colin and Sandro, to help us unpack the latest evidence on how climate change reshaping and impacting health, not just here at home, in Australia, Pacific Islands, and in Asia too, because I know you bring such a wealth of insights from those contexts. And we were talking in our meeting just before we kicked off about the way we want to focus on not just the challenges, we also want to focus on the innovations, the stories of hope, the inspiring stories from the Pacific Islands, from the mega cities of North Asia. You know, what's being done by other systems to proactively cope with and prepare for climate change and support people's health and well-being. Colin, can I start with you, please? You have a unique perspective to share today. You've got a deep understanding of the health challenges Kiwis face, but your work and research gives you insights into what neighbours in the Pacific are facing also. What would you say are the most pressing health-related impacts of climate change for us to be aware of? For everyday people, what concerns should whānau, schools, workplaces here in New Zealand be vigilant about? Are there things that we really need to keep an eye on in regards to climate change for our health and well-being?
Kia ora tātou, kia ora, Lucy, and thank you to the Foundation for this invitation. I also want to acknowledge Sandro, who's sharing the platform today. I think it's important to just preface this intervention by saying, by the way things happen, in my case, I focus on health. But it's important to point out that the climate crisis, climate change affects all aspects of society, people's lives and livelihoods. So it goes beyond health. The other thing to say is that the media and many commentators get excited about cyclones and floods and dramatic events like that. But there are equally damaging impacts of climate change, sea level rise, for example, ocean acidification, coral bleaching. Are equally problematic. And so I think it's fair to say that it doesn't matter where you live in a Aotearoa or in a small Pacific island or elsewhere in the world, climate change affects us all. And so there are clearly published impacts of the climate change, impacts on water quality, on food security, on potential further spread of vector-borne, diseases like dengue and so on that get spread by mosquitoes. But there are health impacts, and we're increasingly understanding the impacts on mental health and well-being. And we did a study in Polynesia in the last 2 years, and impacts on mental health has clearly come to the fore as a result of climate change. So, impacts of heat, increasing numbers of deaths related to heat. Uh, so, I think it's fair to say that the climate crisis affects all aspects of the determinants of health on factors that impact our health: food, water, the air we breathe. And in the Pacific Islands, I also want to say that there's been some recent work on the healthcare facilities that are, hospitals, clinics, facilities that people rely on, particularly in times of severe weather events, for example, that these hospitals and clinics are located in vulnerable positions around the place. And in some islands, there's only one facility. So people are vulnerable, not just in terms of their impact on their health, but also on facilities that they rely on to get help when they need it. So truly affects all dimensions of lives and livelihoods. And the last thing I want to say on this is that I get the impression that here at home in Aotearoa, people think that climate change affects our relatives in the islands, but we're good here and we're okay. It doesn't impact us. And I think the severe weather events in New Zealand in recent times should hopefully make people more aware here at home about the fact that we can't escape the impacts of the climate crisis.
Thanks, Colin. It's a fantastic point, and I worry about that too. The fact that I think climate change, many good Kiwis have worried about it for a long time, but they haven't necessarily seen that the effects are here in our country already to stay. And I think health is one of the kind of lenses we can see the immediate impacts through. And as you say, there's everything. It's health infrastructure. If a storm or a flood takes out a road, you can't reach the hospital. It's the warming weather. Does that mean mosquitoes are going to come and take root in New Zealand that can carry new and more dangerous infectious diseases? It's the deadly heat that we're going to explore a bit further in this webinar that impacts all sorts of areas of people's health. So I really, that's a huge takeaway for me, that in New Zealand we need to be more vigilant and more aware of the way that's impacting us already here, and that it's certainly not something that's just out there in the region for us to sort of take an academic interest in. And that's part of the reason for this webinar today. So yeah, thank you. That's a fantastic answer. I'll turn to Sandro now. And Sandro, you've got an incredible body of experience dealing right across the whole region. We talked about the 2.2 billion plus people in your region of concern, the Western Pacific region, the World Health Organization, the 38 countries and areas. It's such a diverse region. You've got mega cities, you've got rural areas, you've got desert areas, you've got small island states, and some of the most climate vulnerable countries on the earth. Diverse cultures, incredibly diverse approaches to health, including traditional and indigenous health methods. There's the full gamut. You're seeing a lot of different approaches and innovations and experiences. So my question is, with your bird's eye view at Hua's, what can you tell us about how this is a bit of a broad question. What can you tell us about how climate change is affecting health across the region? But I wanted to zero into one of the points that Colin raised, deadly heat. Last summer, there was some really serious deadly heat waves in your home state of Victoria over the Tasman, Australia. And it's a good climate health issue to tackle, I think, for the reasons we just talked about. And it's called the silent killer because it exacerbates all sorts of diseases and underlying health risks. And, where you are at the moment in Seoul, where you're based, Seoul, the city of Seoul, is experiencing urban heating with climate change. What sort of insights can you give us about how heat is impacting people across the region, and maybe some hopeful stuff about what we can do?
Yeah, thanks very much, Lucy. And it's great to be here. Kia ora. And Such a privilege to join alongside such a superstar and a statesman of global health, Sir Colin, who I've long respected and really looked up to in my career. So I want to start by acknowledging just how lucky we are and how fortunate New Zealand and the region is to have Sir Colin and his leadership. Also, of course, Helen Clark, who I've been fortunate, Honourable Helen Clark, to have as a friend and a mentor for the last 10 years. And it continues to inspire me, just the contribution that the Honourable Helen Clark makes to global health. It's amazing to think that it's been, well over a decade since she left Prime Ministership, and yet she continues to have an enormous impact on the discussions, the quality of leadership, and of course on global health, including through her latest role as the chair of Gavi. And I really want to thank her for her tireless efforts. I don't know how she does it, but she's an inspiration to so many. Look, climate change, as Sir Colin has already outlined, is increasingly recognised, not simply as an environmental issue, but really as a fundamental health issue. It affects, as we have already started to explore, the air we breathe, the food we eat, the safety of the homes and the hospitals that we experience, and of course the resilience of our communities. And climate change is not just an environmental crisis. It really is rapidly becoming the defining public health issue of our century. I lead a WHO office based in Seoul in South Korea. It's part of the regional office of the World Health Organization. We work with more than 20 country offices across the region, and of course with headquarters. From Vietnam to Vanuatu, Beijing out to the Pitcairn Islands, environmental challenges, climate change, as well as environmental threats are again and again the number one challenge, the number one concern for policymakers. The way that we think about climate change and environmental health challenges is through a systems lens. We know from policymakers that they're not addressing heat on Monday and air quality on Tuesday, and then issues of chronic disease or ageing or infant and maternal child health issues on a Thursday. All of these things are happening at once. And as you said, there are compounding impacts of climate change, whether that is poor air quality experienced by more than 90% of cities around the world, or whether it's indeed the increasing challenges of extreme heat, having far-reaching and incredibly complex physiological, social, cultural, economic, and of course health impacts on populations. So we divide our work first of all into climate resilient sustainable health systems. That's our first portfolio of work, helping countries to mitigate and adapt health systems, to prepare and inform health systems in the context of a changing climate. Climate change is real, it's happening. We need to adapt, but we also need to continue to do our part, particularly as high-income countries, in terms of rapid decarbonisation and, of course, mitigation. The health sector using 5 to 7% or emitting 5 to 7% of global greenhouse gas emissions. It's an enormous responsibility. And as healthcare professionals, we all took the oath, first do no harm. We need to find ways of doing less harm in the healthcare that we provide. Second area is our urban and islands work. So we do frame it very much in a regional context. Our environmental work on heat, air quality, sea level rise, and of course, environmental pollutants, microplastics, PFAS, all of that we bring together in this portfolio we call urban and islands work, because it is it is from the mega cities of Seoul, 25 million people sitting and living in the city that I call home, through to some of the smallest member states, just over 10,000 people in a country in some of the most isolated but strong and culturally rich environments and cultures in the world, out of course in the Pacific. And the third group is the third focus of our work is around food systems. We know that across the Western Pacific region, climate change is already reshaping lives. WHO estimates that about 3.5 million deaths each year in our region are affected or influenced by environmental risks, and 2.2 million deaths annually associated with air pollution alone. And we are a region that accounts for roughly 1/3 of global air pollution deaths. And I'm seeing three main patterns emerging with regards to the intersection of health and environment across our region. The first is extreme heat, absolutely a focus. I was in Singapore this week, but countries everywhere, donors, countries, communities, clinicians, everyone is talking about the impacts of heat because heat is affecting us now. We walk out of our offices, of our clinics, of our schools, of our homes, and you can feel that the temperatures are changing. You can feel that the combination of humidity and heat is having more of an impact on every aspect of our lives. And of course, those most vulnerable at either end of the life course. In Japan, we're seeing extreme heat events increasing and overwhelming health systems at certain points across the year, particularly during the peaks of summer. In Australia, we saw major heat waves with sharp increases in cardiovascular and respiratory admissions, so real clinical consequences for health systems and for emergency departments. And cities such as Seoul and Tokyo now operating full-scale and very sophisticated heat health warning systems. Even air-conditioned bus stops now we're seeing across Seoul and the parts of mega cities across Asia in the peak of summer, because we know that those most vulnerable are more likely to take public transport. We see them being exposed increasingly to extreme temperatures as they're going about their lives. In the city that I call home, they've installed almost 4,000 sun blinds on almost every corner of the major intersection corner across Seoul. These blinds open in the heat and the rain, and again looking at ways to try and increase shade coverage and address the growing problem of heat. The second is, of course, air pollution, and there is a lot of great work. I'm not going to talk about all the problems. We know how much of an issue this is. We know that most of the population in our region lives with poor air quality that affects, not just lung conditions, but increases everything from poorer mental health to even intergenerational risks with newborn children or in utero. But we are seeing a lot of really exciting action. China is, of course, Beijing is the greatest example, a city that managed through its Blue Sky initiative to reduce PM 2.5 by 40% in just 10 years, completely transformed the air above Beijing. Now, that started as an initiative largely incentivized because of the Olympics, but it is something that has not only become a permanent fixture and a major co-benefit for the human health of Beijing, but also inspired others. We're seeing now other countries and cities across the region wanting to do similar. Just recently, Vietnam announced that they're going to phase out petrol motorcycles in some of their major cities. That is going to, again, transform air quality. And anyone who's been to Vietnam will know how that's not only going to transform air quality, but also if you think about noise pollution and just the quality of life for so many people in that city. The Republic of Korea is also strengthening national monitoring and pollution controls, particularly looking at transboundary, but also within its major cities. And the benefits of poor air mitigation are clear. In terms of food and water systems, we're seeing, we are seeing significant challenges, particularly sea level rise, which was brought up before by Sir Colin. Such an under-recognised issue. Whether it's sea level rise pushing microplastics and plastic pollutions further up estuaries across China, across Indonesia. When tides are higher, the pollution is pushed further inland. We don't think about these things. Saltwater intrusion in affecting groundwater and small-scale agriculture in Kiribati and Tuvalu, but also in the Vietnam Mekong. That salt water makes it into the food system, increases hypertension, maternal hypertension, as well as adult hypertension, which increases cardiovascular disease. So the impacts of sea level rise are not just solved by building a wall or raising a floor. These are serious, complex, systemic effects that are showing up in the health of populations directly, but also indirectly in so many ways, and in many ways we still don't understand. I'm just going to finish by summarizing, because I think there are, heat, air quality, and food related to emissions, the carbon impact of our food system, these are three areas that are well understood. I'm seeing lots of research, lots of focus, lots of energy, and importantly, lots of capital being deployed in these areas. Just this week, I visited again the Global Heat Health Information Network run by Professor Jason Lee and funded by the Wellcome Trust and Rockefeller in Singapore. These hubs are being scaled up around the world. I feel as though everyone is talking about heat, which is great, and it's critical that we do. On the other side, I think there are a number of areas that we are under-recognising when it comes to the impacts of climate change on health. The first is the synergistic effects. Heat doesn't happen alone. Heat, in combination with humidity as well as poor air quality, has compounding effects, and we need to start to better understand these sort of overlapping effects. People are not living in megacities or in small islands with just poor air quality. They're also experiencing extreme heat and a range of different exposures. The second is the impacts of the environment on food and food on the environment. Microplastics and pollutants now making it into our food supply, still an under-recognised issue in our region. We really understand the impacts of emissions. You know, how we all know that 1/3 of global emissions come from our food system. We cannot reach our NDCs without shifting our food systems. I know a complex issue, particularly for New Zealand, but New Zealand is on the road and has in some cases made huge strides. But the environmental impacts beyond just emissions still is largely under-recognised. And the third is, as I mentioned, sea level rise. I think this is going to be the new heat. In 5 years' time, we will all be talking about the health impacts of sea level rise. At the moment, it's largely absent from global agendas. Small pockets of scientists or political leaders really thinking about this. The Pacific has warned us loud and clear for a long time, has asked the global community to act, and largely, I don't think we've listened as much as we need to, and that's an area that I think we need to continue to stay focused on.
Thanks, Andros. Pretty powerful insights and also pieces of advice for future work and focus, both here at home and in terms of what the global community does. Sea level rise is a really interesting one here in New Zealand because it's actually been gripped up quite firmly as people, all part of managed retreat of communities, insurance or uninsurability of homes, and civic spaces. And I think worldwide, the number of the world's main cities that are actually prone to sea level rise, devastation quite soon, with rising sea levels is startling. New York, many cities, famous cities that we think of are actually, as you say, it's a critical issue for them. But for some reason, I think perhaps because of the enormity of the frightening nature of the question, people are failing to talk about it as much as they should. But I want to reassure you that here in New Zealand, we've at least begun the discussion, but it is something that we do need to keep focusing on. The other point that I just wanted to pick up on, oh, sorry, you go.
No, I was just going to say, I mean, 2/3 of our region live on the coastline. So this is an existential issue for our region. We're also some of the largest emitters and some of the most vulnerable communities. So I think we are the region that has to lead when it comes to this issue, not wait for, those in other parts of the world who do emit more and should be taking action, but likely won't to lead. I think that the time is for Asia and the Pacific to lead on this issue. And you're absolutely right. I mean, think about 300 million people living on the archipelago of Indonesia, just above the country I come from in Australia. We have this is a defining issue in many ways. And just last week, The Guardian published a fabulous piece, if people are interested, showing that in fact the modelling that we've done to date vastly underestimates the level of sea level rise that we can expect this century. I think the reason that we're not focused on it is far simpler, actually, Lucy. I think it's just simply because the water is not yet lapping at the feet of most people. The Pacific gets it. They're calling for it, and they see this as a justice issue, as it is. It's an international justice issue. But the reason I think we're seeing such movement on heat is because most of this region cannot avoid it now. And that will be the case for sea level rise very soon. But I just hope we're able to act before rather than wait for it to be at its worst.
I think it's a really important point, and also to extend your point, we have the opportunity at this year's COP, the Pacific COP, although with unique hosting
Absolutely.
arrangements between Australia and Turkey. It is the Pacific COP, and this is our opportunity to tell real life stories and present some courage, both on the part not just of the Pacific nations that we rely on to be courageous in the climate change space, but also the big emitters, and the middle countries, the New Zealands and the Australias, to really show some leadership on solutions. And as you say, it's not an academic problem in the Pacific Islands or countries or communities where you have the water lapping at your feet. It's real. So we need to feel that sense of real and keep moving. And for Kiwis in the audience, I think that's part of why we may wish to feel motivated about pushing in the coming election for attention on climate action. Thank you, Sandro. Colin, turning to you, Sandro pointed to one of the things that always gets me excited when I think back to my work in the international world of development. One of the most exciting things also in global health was seeing the way that countries would learn from one another about successful approaches. So when I was managing the bilateral global health side of our health diplomacy for the New Zealand government, we were at this time learning about primary healthcare reform, talking with the UK and other systems, and the Singaporeans were talking to us, and everyone was learning and sharing best practice. It was wonderful. Meanwhile, over in the science and research community, there's amazing stuff happening in our region with amazing potential. And you've recently spearheaded organising the first Congress of the Pacific Academy of Sciences in Apia last month. Congratulations. That sounded like a fantastic event. There were so many announcements arising from that event. And the regional director, Dr. Sire, came from the WHO and helped with opening. So that was just a wonderful event to see taking place. And so you're seeing firsthand, you're at the forefront of Pacific science and climate and health and other innovation. Colin, can you share some of, I guess, the initiatives maybe that you've seen crop up as a result of the recent Congress, things that are happening in the health space and the hopeful climate and resilience space, maybe science and research that we can all get excited about, that some in the audience or most of us wouldn't actually have an opportunity to know about. So if you could share a little bit from that event and give a sense of the dynamic work that's taking place, that'd be fantastic, please.
Thank you. A few things, but just before I respond to your question, I should also say that we are part of a global study on the impacts of heat on health, on sleep, on cognition, on a whole range of things. And we have had a site in Niue, and we're just starting another site in Fiji, but it is a global study funded by the Wellcome Trust. And in time, we'll be able to have more specific information about the impacts of, well, we know already, of course, as Sandro's pointed out, the impact of heat on people's health and well-being. But this study will enable us to have more specific information about what happens in our region. In terms of your question, yeah, we were fortunate to have been supported by a number of stakeholders to set up the Pacific Academy of Sciences. There's a recognition that the Pacific voice, if you like, in the science and research space is drowned out by the global north mainly, and that's not a criticism, it's an observation. And the hope is that we would be able to generate more homegrown information that is relevant to the region. At the Congress, we were able to establish the Young Science Academy as a pathway and as a support mechanism for young people from the Pacific who will focus on climate change, on NCDs, on drug addiction, on a whole range of things. In other words, it's time to step up in terms of the Pacific voice. I should also say that the Pacific, in many ways, the Pacific Islands have been fortunate to have been supported by SPC, the Forum, and SPREP to do a range of things that on the surface of it, you might say, well, it's not really health, but it's actually indirectly benefits health. For example, a range of activities that SPC promotes in enabling small island states to get access to fresh water. Fresh water is such a fundamental, but often inadequate source for people's health. A lot of the childhood illnesses in Micronesia directly related to poor water quality, and Sandra's talked a little bit about this already. So it's important to recognize that the Pacific has in many ways been leading mitigation adaptation measures, whether it's to do with crops or water or environmental. They do have lead to health benefits for people. And as I say, they're fortunate to have been able to work together as a group of nations facilitated by SPC and the forum and so on. For people who are interested in the details, probably the best website on these activities is either SPREP, the Regional Environmental Program, or SPC, because it'll tell you there what individual countries are doing. So I do want to confirm that I think the Pacific Islands is in many ways are leading a number of these initiatives. They're a bit they're good at setting targets and goals, and that's a good start, but perhaps not as rapid in implementation. I refer, for example, to renewable energy targets and people wanting to rely less on fossil fuels, for example. So really encouraging trends, perhaps a little sluggish on implementation. And I use that example of renewable energy as an example. And all of these interventions, particularly in mitigation adaptation space, will have benefits on health and well-being. I should finish off by saying it's unfortunate that the global instrument on reducing emissions, the Paris Agreement, has been in limbo, if you like, or not as strongly supported as I would have liked, because that really is the driver for reducing emissions and the globe and the global community acting together. And I also think that our governments pulling back on our own targets is not very good. And perhaps, as you say, in election year, people might want to think about what they might want to say to their local MP, because it doesn't matter how much effort and work you put into adaptation and mitigation. If we don't reduce emissions, we haven't turned the tap off. But a lot goes on in the Pacific Islands, I would say.
Mm. Thanks, Colin. Sandra, did you have something you wanted to add to that?
Yeah, look, just very quickly, I just want to I think many things that Sir Colin said was really critical. I just want to reiterate two of them quickly. One is, we cannot just focus on adaptation. It's irresponsible and it's not going to get us to where we need to be. It's very convenient, but adaptation. Just I hope I said adaptation. Mitigation has to continue to be a cornerstone of our efforts, particularly if we have any sense of responsibility and allyship for other parts of our region. The second is, I think the type of research that Colin is leading in the Pacific is exactly the type of research we need to be supporting more. Looking at and working with communities and populations that have largely been left out of the conversation. Granular studies looking at the impacts and co-impacts of heat beyond just the kind of the surface level which has been done. The impacts are so far-reaching. We need to understand these, unpack them for policymakers. And the third is, policymakers are wondering what to do. We need really translation and operationalization focused research. And so again, just really support the work that Colin is leading, particularly in the Pacific. From a healthier communities perspective, I think that, we also can't forget the kind of dyad between healthy communities and healthy health systems. We can talk about this more, but there's a lot of work happening across the region on both sides of strengthening cities, preparing and adapting, but also really focusing in on health systems to make sure that they're ready for a changing climate, changing weather patterns, changing disease patterns.
Thanks, Sandro. That's a really good point. Collins, the point you've just made about the work to be done, and the point you made, Colin, about the pace of implementation, the innovation and the research is there, but sometimes the implementation of programs to mitigate the impacts of climate change on our health can be a bit slow. And I was going to say, no-brainer that often it's a money thing, and health systems need to be efficient and effective in how they deploy resources in health system strengthening and resilience, but more money is needed, particularly in the Pacific, to support health adaptation. And coming back, Colin, again to your point on UNFCCC and the COP, and some of the global developments we've seen, we at the Helen Clark Foundation are very concerned about the stepping back from support for multilateral institutions and funding, stepping back in narratives around how the rules-based system is obsolete or not needed anymore. I mean, that's clearly untrue. Some of us are working on some pieces around the importance of the rules-based system for our everyday lives. It's not just global health, it's in every area, agriculture, aerospace, just every single area of our world is informed by a really important and rich network of rules that help keep us secure and healthy and safe. I just turn to the point you just made, Sandro, about strengthening cities. Before we run out of time, because we should be going into Q&A shortly, we're in the middle of a major infrastructure conversation here in New Zealand at the moment. It's a big buzz. I mean, it's big buzz for most governments as they look about how to go on in future. But building sustainable cities and apportioning a limited public dollar to doing the right things and investing in the right sustainable infrastructure is a really strong concern for New Zealand. Can I ask you, given your insights across cities right across our region, how do you think, are there some quick takeaways about how we can build healthier cities? What sorts of infrastructure should we invest in? Are there innovations for heat and air pollution we should consider for our own cities? You've talked about solar, even the corner canopies that you've talked about. I mean, amazing, simple innovations that are amazing and effective and cost effective too. Can I ask you for a few insights on that?
Yeah. Look, and first of all, it is a critical conversation. Dollars are short, but a few kind of opportunities. Because first of all, it's not zero sum. Do we invest in cities or do we invest in health systems? Cooler neighbourhoods need to go hand in hand with hospitals that can remain operational in an environmental crisis or in an uncertain future. But the good news is that actually there are common opportunities. So let's not reinvent the wheel. New Zealand can look to other countries as other countries have long looked to New Zealand. Seoul is expanding urban forests and green corridors, for example, to reduce heat exposure. They've got the most sophisticated food waste reclamation system in the world. 90+% of food in Seoul, a city of 25 million people, as many people as in the country I grew up in one city. 95% of food waste is reclaimed and turned into either compost or biofuel. Singapore, I was there this week, city in a garden strategy that integrates green roofs, shaded streets, urban parks. I could feel a 10-degree difference easily between the walkway I enjoyed on Saturday that was an old railway line that had been turned into a park versus the streets, the paved streets that have only just been newly planted. Cities across China, we're seeing some of the largest electric bus fleets in the world being deployed, improving air quality, reducing emissions, and of course, having health impacts that are far-reaching. Early warning systems and shelters, drop-in shelters for older people, using existing spaces like libraries and community centres as cooling stations and extreme weather shelters for an ageing population. So there's a lot that we can learn from in this region. We don't need to reinvent the wheel. That's number one. Number two, co-benefits. What we do in electrification of our bus fleets or greening the cities is not just about biodiversity, tourism, and feeling good. They have tangible, real health impacts, and that hits the national bottom line. In a country like New Zealand, where most people die and live for at least 10 years with chronic disease, debilitating chronic disease that overwhelms our health system, climate action is chronic disease action, is economic benefit. And so that should be also a really clear message. And so it's not zero sum. It's not, do we invest in climate, smart cities, or do we invest in economically smart cities, or do we invest in health smart cities? They're going to be the same. And I think that needs to be really clear to policymakers, but also to finance ministers in New Zealand and around the world.
Yeah, super important point. I know Helen herself has spoken on co-benefits. It's a critical message. I always say, coming from the health policy environment, you won't have a program unless you can translate it upwards through your treasury and your finance minister. They simply hold the purse strings, and they're not going to fund even the most clearly meritorious health programs unless you can make an economic co-benefit argument. Generally, you'll have a harder time getting success in funding and implementing. Can I quickly just shout out to our colleagues at the University of Melbourne who are doing amazing work on health co-benefits and translation practically to policy.
Very true.
And that's Dr. Annabelle Workman and Professor Catherine Bowen. So I'm hoping there'll be more opportunities for trans-Tasman or regional collaboration, bringing those insights into policymakers' toolkits. Thank you so much, Colin and Sandro. Amazing answers. I feel the audience getting restive and wanting to have some questions. Colin, can I squeeze in one last question for you before we go to Q&A? All of these discussions have reminded us why we need to mainstream public health in our thinking across the board on policy. You, as a former National Director of Public Health, you well remember being in the New Zealand government system, and how the bean counters count the beans, and how money is apportioned to certain priorities, and there are always more things we need to do than we can afford to do in government and across the health system. As a final comment, what three priorities do you think, whether climate or health related or not, do you think that we really need to have people thinking about and talking with their local MPs about as we head into an election? What are our health priorities here in New Zealand?
Oh, I think the key thing I want to say is that perhaps people, as we approach an election, is to remind their MP about the impacts of the climate crisis on health and well-being, and us receding or pulling back on our commitments is not a good look. The second is that we used to be a leader in public health interventions, tobacco, for example, and climate. And again, we seem to be losing our spot, and it's not very good. So here's an opportunity for people to approach their MPs to ask what their party is going to do in respect of the impacts of climate crisis on health. I think Sandro's referred to food systems improvements, and there was some work done by the Public Health Advisory Committee. I think there's some excellent recommendations in that report that we should look at. And clearly, the release of the Royal Commission report into pandemic preparedness is something that we should look at. In other words, we have some fantastic policy documents that we should start thinking about implementation. I would ask the parties and the MPs and the influencers, what are we going to do? We have a lot of these policy documents around, but then we do nothing with it. One of the recommendations from the Part 2 Royal Commission is the idea of a designated distributed communicable disease surveillance arrangements for Aotearoa. I think the Australians have led the way, and I think we would be better prepared if we had better surveillance. I mean, I could go on and list all of these things, Lucy. The point I want to make is, of course, we have some really useful evidence-based policy instruments, we've just got to start looking at implementing some of those, particularly those things that either contribute to further greenhouse gases or potentially benefits that could occur from us acting decisively on those things.
I think that's a really good point, Colin. We have such a strong public health research community. We have really, I mean, I speak as a loyal ex-public servant. We have really good policy coming from Ministry of Health and other parts of government that speak to health concerns. But too often, as you say, Colin, those reports are shelved or sit on the shelf gathering dust and they're not implemented. Sometimes it's a question of money, sometimes it's a question of political will, which takes me to Q&A. And we've got a question here on the fact that the electoral cycle, it's well recognised that it's our enemy sometimes in being able to implement long-term sensible policy across the board in New Zealand and other systems that have a 3-year or even a 4-year cycle. I'm not proposing we debate 3 years versus 4 years right here, but Colin and Sandro, can I ask you, what do you think, how can we do better at building, perhaps we talk about New Zealand and Australia here, how can we talk, sorry, not how can we talk, how can we move to longer term policy making for health? How can we get all political parties within reason across the spectrum to buy into key health priorities? And I think some of the answer relates to what Sandro was talking about in regards to co-benefits. It's about understanding the social consequences, the health consequences, but also the economic consequences. But can I ask you a little bit about what sense of hope you have for building long-term momentum, cross-party momentum? It's one of the key interests of the Helen Clark Foundation is how do we build non-partisan, cross-partisan policy that endures and stops this ridiculous pendulum swing, this expensive reframing of policy every 3 years. Sandro, would you like to go first with an Aussie perspective, and then maybe Colin can share his thoughts on whether he feels hopeful for New Zealand or not?
Yeah, look, I will say it is a challenge, but I think there are some opportunities. So first of all, our region is and will be and should be and can be the defining region for climate action. Everything that's going on in the world, but also, as I said, biggest emitters to some of the most vulnerable communities, even New Zealand and Australia, we can and we must be the defining region in this defining century for climate change. And I think we can be. There's a lot of action going on across the region. If you get despondent in one geography, you don't need to look very far to see others moving forward and not waiting for the next electoral cycle, which keeps me with a sense of hope. The second is the economics. At the end of the day, renewable energy is cheaper. That's just a fact. So whether you believe in it or not, whether you're left versus, left or right, whether you wear blue or red, the economics don't lie. Renewable energy is cheaper, and that's why we're seeing very pragmatic, very large countries in the region very rapidly decarbonize their electrical grid, and move towards batteries and off fossil fuels, not necessarily because of, environmental or other reasons, but because the economics push us in that direction. And I think we'll see the same. We are seeing the same in many countries with EVs, for example. It's been very interesting watching the shift of EVs from early adopters, people who had more money and maybe were very interested in the environment, to now many of the purchases of EVs in many countries are actually low and middle income earners, because they're becoming cheaper to buy and they're far cheaper to run, not necessarily because of environmental reasons. I think the co-benefits are essential. If one argument doesn't work, then let's not hold on and make everything health. If we can get behind another sector and get the same outcome, let's be humble and let's jump on their ticket and support from a policy perspective. And I think we do need to continue to do work to make sure that climate change is not a left versus right issue. In this day of misinformation and disinformation, we've gone down a very dangerous rabbit hole in many parts of the world. But, climate change is not a left versus right issue. What we do about it might come down to political divides, but climate change is just a fact. The climate is changing. It is the existential health issue for our century. That doesn't matter it's not going to be any different or any less of a economic, health, social, cultural risk for you and for your family, whether you come from the left side of politics or the right. And we need to do better, I think, at really in an impartial way, bringing people together, building bridges rather than splitting communities, and as public health leaders using evidence to continue to make the case for action across political divides and across different parts of the region and even within countries.
Thanks, Sandro. That's a hard-hitting but very wise prescription, I think, for how realistically that can actually be done. It's still a long road ahead, isn't it? But you've sort of spoken to the fact you need to take the multiple drivers for change and also be realistic about depolarizing the issue of climate change as much as possible, so we can just look at the co-benefits, look at the health benefits, and actually make some sensible policies and get political parties across the spectrum, whatever the political cycle, to support those. One phrase caught my mind, which was, it's not a left or a right issue, or it shouldn't be. Colin, in New Zealand leading up to the election, how do we make health has become a bit of a left and a right issue in a way in New Zealand lately? How do we compel all sides of the political spectrum to see that health, whether it's pandemic response, looking at our recent Royal Commission, or whether it's health equity, all of these issues have taken a real beating over the last couple of years as we've moved away from wellbeing narratives. I mean, it's not to say social investment isn't good, but how do we make sure health is not seen as a left or a right issue? Health equity, pandemic preparedness, it's important for all of us.
I know you said, Lucy, you said not to be negative, but we don't have a good track record of bipartisan approach to important issues. We've been toing and froing on retirement, for example, and health doesn't quite get there either. So I'm not sure that it's realistic to expect a bipartisan approach. I have a colleague who's enthusiastic about a bipartisan 10-year health plan for the country. And unfortunately, the conversation in Aotearoa in health is about not enough money and people can't get to see the GP. They don't go beyond that. So I'm not sure that bipartisan approach is realistic. I do, though, want to say this. I think there's an enduring and effective public health community in Aotearoa, New Zealand. I would appeal to them to continue to keep the conversation evidence-based and to focus on the big things, because the political cycle, unfortunately, doesn't match. For those of us in public health, we play the long game. The political cycle isn't so long, so it's a bit difficult to see how they can come together. But if we stick together, maintain the evidence, continue the advocacy, say the things that we need to say as a public health community, including the changes that we want to see in the climate change space, I think is a practical thing I would suggest to our colleagues in public health. And I want to repeat, if you use your vote effectively, ask your MP what their plans are, what their party plans are with respect to the climate crisis. That's a practical thing that people can do. And I know there are organizations in our nation that are dedicated to advocating for better approaches to the impacts of climate change on health and well-being in Aotearoa.
That's, again, super powerful, really practical prescription. I absolutely agree with you around the evidence base. And I think as we finish, and I'll have to hand back to our host, Sarah, calling for people to actually have conversations about what does your party policy say about health and our health system and climate change leading up to the election. Whichever part of the political spectrum you support, that's a powerful thing you as a individual voter can do to help affect some change. I would just like to say thank you so much to Colin and Sandro and our audience. Having two busy and eminent panelists today, you guys have given so much Powerful discussion. I've gone away with many takeaways, and I hope the audience has as well. I hope we'll see you again on a webinar like this, and I just wish you all the best with your work and your research, the amazing things you're doing at the Pacific and global level. So thank you, Colin and Sandro. And I'll hand back to Sarah now to close up the meeting for us.
Thanks so much, Lucy, for facilitating today and for bringing these fantastic panelists together, and adding my thanks as well to Colin and Sandro. That was an incredibly illuminating conversation, not only about the challenges, but about some of the solutions, both practical solutions that are being implemented now, and some of the things that we can do here in Aotearoa, New Zealand, to drive change in the right direction. And we know that's something our audiences really want to hear, and it's something we as a foundation really want to focus on, is not just what's the problem, but what can we do? So thank you so much for making the time in your very busy schedules to be with us, and appreciate hearing from you. And thank you to our audience as well for joining us. Enjoy the rest of your day.